When we talk about sexual dysfunction in women, we know that physiologically there are parallels that we can look at. When we look at the psychologic aspects of sexual function, the obvious difference in men and women is that men know when they have an erection. We have data that shows that in some women, not all, I'm generalizing obviously, but there's a disconnect. We've talked about the relationship between the brain and the end organ. And in most men, when they're aroused, when there's an erection, we can have increased blood flow to the penis, and we can have increased blood flow to the centers of the brain that are involved in arousal. We actually have studies in women that show that there may or may not be a disconnect. In other words, women may have increased blood flow in their centers of arousal in their brain. They believe that they are aroused, but when we look at blood flow in the pelvic area at the sex organs, we don't see that blood flow. We also see women who may have increased blood flow to the clitoris, increased lubrication, increased blood flow to the vaginal tissues, but scans of the brain don't show that similar increased blood flow to the brain. There's a disconnect. We don't know why, and we don't know what that means. We also know that about 50% of the time when we talk about female sexual dysfunction, we absolutely have to look at their relationship with their partner. If there is a problem or concern or a conflict in the quality of the relationship, that's going to impact negatively sexual response. Women have, in general, again, a higher concern about body image that may negatively impact their ability to be sexual. Very different from men. We also know that women are more likely to be distracted when it comes to sexual dysfunction about non-sexual things. The laundry isn't done. When are the kids coming in? And I don't want to be interrupted during intimacy. We have other things to worry about right now. I've got to get the kids going, and I've got homework for the kids to do. These are things that are not good or bad. It's just items or issues that the person who's tackling sexual dysfunction, whether a therapist or a urologist or a urogynecologist, has to be aware of. It's not just giving a pill or giving testosterone or having someone lose weight. There are a lot of other factors involved, and that's why an open discussion and open communication is hugely important when we talk about the opportunities to address sexual function in women.
The Department of Sexual Health is a unique facility dedicated to evaluating and treating both men and women for sexual dysfunction. We are proud to offer such a facility and reach out to our community in an effort to raise awareness about the potential risks that cause sexual dysfunction. We believe that this private issue is becoming more open to discussion with the men and women of today, and we are here to help rekindle relationships as well as teach wellness, healthy lifestyles, and bring back a quality of life we all deserve. At the Department of Sexual Health, we are here for you when you're ready for us.